Welcome to Preparatory for Respiratory. Today's webinar is an infectious disease training for school nurses and childcare providers, where we will talk about, you guessed it, infectious diseases that can be spread via the respiratory route. Today's webinar is being presented by the DISH team. DISH services daycares, schools, and higher education settings in the state of New Jersey. And let's go over our training outline for today's webinar. So I must first give the disclaimer that today's training is not even coming close to covering every respiratory infectious disease that you may see out there. Since we only have an hour together today, this training is only going to show you examples of viruses that can be transmitted via the respiratory route. Remember, examples of agents that can cause infectious diseases are viruses, bacteria, fungi, and parasites. So first on your agenda today is to talk about some examples of respiratory viruses. These are examples because there are many viruses that can be transmitted via the respiratory route. So today's webinar is just to introduce you to some of the most common respiratory viruses circulating in the community. After we go over examples of respiratory viruses, we'll talk about what may be considered an educational setting outbreak, as well as prevention recommendations that you can implement at your educational settings. But before we dive in, let's start off with a poll question. What do you think is the most frequent cause of the common cold? So no pressure here, just an icebreaker question. We want to gauge your thoughts before we get started. All right, let's take a look at those results. Thank you for your answers. So according to the CDC, rhinoviruses are actually the most frequent cause of the common cold. So on your screen right now, you can see examples of types of viruses that can cause respiratory disease. Some examples we will be discussing today are influenza, parainfluenza, respiratory syncytial virus or RSV, enteroviruses, human metapneumovirus, adenovirus, rhinovirus, and human coronaviruses. People who are sick with these viruses often feel some or all of the symptoms that you see bolded at the bottom of your screen right now. As these are all respiratory viruses, you can imagine that coughing and runny or stuffy nose are common symptoms. People often have a fever or feel feverish as well. However, it's important to note that not everyone diagnosed with these diseases will have a fever. There are also a lot of other symptoms that these viruses can cause that aren't listed on your screen right now. For example, we know that a loss of smell and taste is a symptom that can be seen with COVID-19 infection, which is a coronavirus. So additionally, some other symptoms that you may see with some of these viruses include vomiting, diarrhea, conjunctivitis, irritability and ear pain, skin rashes and mouth blisters, and shortness of breath. So this symptom can be very concerning, and individuals who have trouble breathing should definitely seek a healthcare provider's attention immediately. And then when these respiratory viruses are a little more severe, you can have wheezing, barking coughs, and hoarseness. And when serious illness occurs, these respiratory viruses can lead to complications such as bronchitis, bronchiolitis, and pneumonia. For a complete list of possible symptoms for each of these diseases, we encourage you to visit CDC's webpage specific to each disease. Hyperlinks to these pages are provided in the slides that we sent out at the beginning of the webinar in the chat, and you can download the presentation and click on the hyperlinks from there. All right, so let's get into our next poll question. According to the American Academy of Pediatrics, or AAP, what virus is the most common cause of croup? Croup is an illness characterized by a hoarse voice and barky cough. The symptoms of croup are caused by the primary area of infection, which is the larynx, which is also commonly referred to as the voice box. Thank you again for your answers. So according to the AAP, the correct answer is parainfluenza. And although parainfluenza viruses are the most common cause of croup, many other viruses such as RSV, measles, influenza, rhinoviruses, and enteroviruses may sometimes cause croup as well. So now let's talk about how these respiratory viruses are spread. Respiratory viruses are spread primarily from person to person through respiratory droplets of infected people when they cough, sneeze, or talk. These viruses can also spread through touching a surface or object that has the virus on it, and then touching your eyes, nose, or mouth. Some respiratory viruses can spread through an infected person's stool, for example, during diaper changing and also through the water, like in swimming pools. Okay, another poll. I know there's a lot of them. This one is true or false. You can spread the flu to others even before symptoms appear. All right, I knew you guys would know this one. So the answer is true. You may be able to spread flu to someone else before you know you're sick, as well as while you are sick. So let's talk about why. So here we're going to discuss some important timeframes that you may want to note for these diseases. The incubation period is the time from exposure to when symptoms develop. The incubation period can give you an estimate for how long you might need to monitor for illness if you or somebody in your educational setting is exposed to one of these viruses. In our poll question, we just found out that influenza can be spread prior to symptom onset. Though individuals with these viruses are likely more contagious when they have symptoms because of the increase in respiratory droplets from coughing and sneezing, there has been scientific studies conducted that have proven that many of these respiratory viruses on the screen right now can be spread asymptomatically. So I should probably define asymptomatically. So that could mean that the person is contagious, but they haven't developed symptoms yet. Or it could mean that the infected person had symptoms, but now they are symptom-free, but they are still contagious. Or it could mean that they have tested positive for a virus, but they never got symptoms. So lots of ways to be asymptomatic. For those that are symptomatic, symptoms can last for a range of a few days to a few weeks. And those who are immunocompromised may be sick for a little bit longer as well. So now we're going to talk about seasonality of viruses. Although these viruses do have seasonal periods when we expect an increase in illness, any of the viruses that we're talking about today can occur at any time of year. The chart you see here is based on when the CDC says that they're most likely to occur. The seasonality chart does line up closely with what we see here at the New Jersey Department of Health. As you can see, at least one respiratory virus could be circulating in each season. And unfortunately, there is a chance that you can get reinfected with many of these viruses throughout your lifetime and even in the same season. And it is also possible to be co-infected with 2 or more respiratory viruses at once. If you're interested in New Jersey specific data about these diseases, this page goes to the New Jersey Department of Health Influenza and Respiratory Illness Surveillance Reports. This is a surveillance report that's populated weekly from October to May and made available to the public. So the reason that we look at surveillance data and not true case counts is because most of these diseases are not reportable to public health when single cases occur. They're only reportable when outbreaks or suspect outbreaks occur. And most of the time, we're only able to identify outbreaks when we have testing for these viruses, which adds another layer of complexity because testing just isn't frequent for a lot of these. And thankfully, a lot of the time, the symptoms for these diseases are very mild. So children never see a healthcare provider for testing. But as I mentioned, outbreaks are immediately reportable to public health. So I can show you how many outbreaks of these illnesses we received reports of from educational settings in the 2022-2023 school year. So from September 1st, 2022 to September 1st, 2023, New Jersey Department of Health received 913 reports of infectious disease outbreaks from educational settings. These settings include schools, childcare centers, sports teams, institutes of higher education, and camps. The majority of the outbreaks that were reported in this time frame were from schools and childcare centers. And approximately 82% of those 913 reports were caused by the respiratory viruses that we're discussing together today. Of course, novel coronavirus was by far the most reported, followed by hand, foot, and mouth disease. So as you may know, hand, foot, and mouth disease not only has rash symptoms, but other symptoms like fever and flu-like symptoms may also be present. Hand, foot, and mouth disease is actually an enterovirus, one of the viruses that we're discussing today, and that's why this category is important. So close behind hand, foot, and mouth disease were reports of influenza, followed by RSV, and finally, general respiratory. So this classification is made up of outbreaks reported to the Department of Health where several students were sick with respiratory symptoms at their educational setting, but none of those students ever got tested or received a diagnosis. So as you're looking at this chart, you'll notice that some of the viruses we're talking about today, such as human metapneumovirus and parainfluenza, are not listed. The lack of testing for these diseases may be one of the reasons for that. And then, of course, I just want to remind you that we only have this data to show you today because educational settings actually reported these outbreaks to us. So outbreaks are required to be reported according to New Jersey Administrative Code 857. But aside from it being a requirement, the reports made by schools and child cares really do help public health to know how these diseases are affecting our communities. And child cares and schools are vital players in keeping our communities safe from infectious diseases. Okay, time for another poll. This one is a yes or no. Can you let me know if at least one of those respiratory outbreaks that I just talked about happened at your school or child care center last year? Oh, pretty even. Okay. So for those of you that said yes, thank you so much for all the work that you did to manage and stop these outbreaks from spreading any further. I know you guys have a lot of knowledge to share after your experience with handling one of these outbreaks. Shortly, we're going to discuss prevention and control recommendations for managing respiratory illness and outbreaks. And if you find that we forgot something that worked well in your child care or school to help conclude that outbreak, please let us know in the chat. And for the half of you that said no, hopefully you guys are just as lucky this year. Okay, so now that we've discussed examples of respiratory viruses, let's move on and discuss how you would know if an outbreak is occurring. So let's take a look at the general guidelines for the control of outbreaks in schools and childcare settings document. This document, which can be found on the New Jersey Department of Health School Health page, reviews reporting requirements, how to identify if an outbreak is occurring, and recommendations for outbreak management. At the bottom of page 1, shown here, it says an outbreak may be occurring if, and then it lists 4 different red flag scenarios that are a signal to call your local health department so they can help you assess whether or not you have an outbreak. So let's take a look at those 4 red flags in more detail on the next slide. Okay, so the red flags that you see listed here can be used to help figure out if an outbreak may be occurring. So if you notice several children with similar symptoms that are in the same classroom, the same wing, or attended a common event, you should call your local health department and talk about whether or not you have an outbreak. Also, if there's an increase in school absences with many parents reporting similar symptoms as the reason why their child's not attending school, you want to call your local health department. And then another red flag would be if you see 2 or more students diagnosed with the same reportable disease. In that case, once again, you would want to call your local health department. And if you need a list of the reportable diseases, you can find one hyperlinked to this slide. We're going to open it up right now and show you. So this is the reporting magnet, and it lists diseases that are reportable immediately and also diseases that should be reported within 24 hours, and all reports should be made by phone. And then back to those red flags. The final one is if a single case of a highly infectious disease such as measles or pertussis comes to your attention, you certainly want to call your local health department. And remember that these reports should be made even if the diagnosis is not provided yet, because investigations should not wait and management can be very time sensitive. Okay, so inside the general guidance document, there is a sample notification letter to families about exposure to communicable diseases that you can utilize if you do have an infectious disease situation occurring. It's always best to get your local health department to help you with these notifications before sending them out, just for accuracy of specific disease information. Now, this guidance document is the general guidance document that can be used to help guide you through any infectious disease situation. However, we do have another document that is specific to respiratory outbreaks. And you can access the respiratory outbreak information guidance document by going to the New Jersey Department of Health School Health page, or by clicking on the hyperlink at the top of this slide. And this says, if you think an outbreak may be occurring, of course, contact your local health department for guidance. And during flu season, we would expect a school to experience cases of flu or respiratory illness, but you only need to contact your local health department if you notice any of those red flags that we discussed from the general document. And if you need to figure out who your health department is and what their contact information is, we have included the link to the local health department finder tool on this slide. So this tool is very easy to use. You just type in the address of concern into the tool, and it will show you the name and the contact information of the local health department associated with that address. And it's important to establish a relationship with your local health department early. So if a concerning situation arises through the year, you know exactly who to contact and how. Okay, another poll question. Would you report several cases of influenza from the same classroom that occurred in the same week to your local health department? And this is a yes or no question. Okay. Most of you said yes, and that is the correct answer. So you should report several cases of influenza from the same classroom that occurred in the same week to your local health department. Several cases occurring in the same setting and time frame of any of the respiratory viruses that we discussed today would be concerning and should signal you to reach out to public health. Now, just to clarify, that doesn't mean that several cases in the building would for sure be an outbreak. So you have to consider if there's a connection between the cases that could explain the transmission of the disease. So if there's several flu cases in the school, but these people don't have any connection to each other to pass the flu around, then it's not an educational setting outbreak. It's just a general increase in illness from the community. So next, I'm going to pass it on to Victoria to talk about prevention recommendations and resources.
Hi, everyone. Before Victoria starts her presentation, I'll just give you a brief background about her. Victoria Simpson is an epidemiologist on the DISH team with previous experience managing outbreaks at schools and daycares within a local health department. She studied epidemiology and occupational health at the University of Toledo in Ohio and public health administration in Tennessee at East Tennessee State University. Victoria, please take it away.
Thank you so much, Kendra. So let's get started and talk about some prevention recommendations for these respiratory viruses. So of course, a vital prevention tool is vaccines. CDC says 4 million deaths worldwide are prevented by childhood vaccinations every year. So we do encourage everyone to get vaccinated for COVID-19 as well as influenza. And vaccines are also now available to protect some adults against severe RSV. And though not a vaccine, there's also new exciting prevention tools for RSV, such as monoclonal antibody products that are available to protect infants and young children. And if you want to learn more about those prevention tools, we have included hyperlinks to these slides to more information from CDC about that. And unfortunately, we don't yet have vaccines for all of the respiratory viruses we're talking about together today, but hopefully we will in the future. And you can find a lot of additional prevention recommendations in the respiratory outbreak information guidance document that Stacy talked about just a little bit ago. So first, it mentions that you can do things such as separating sick students and staff from others until they can be picked up to go home. So when feasible, if you can identify a sick room through which other individuals do not regularly pass, that would be very helpful. The sick room should be separated from areas used by well students for routine health activities, such as picking up medications. And sick room staff should be limited in number, and they should be individuals who are not at a higher risk for getting severe disease should they get sick. Second, increasing frequency of cleaning of common areas and frequently touched surfaces during peak respiratory seasons is important as well. And of course, it's also important to encourage students and staff to have frequent hand hygiene. So teach students and staff to wash their hands often with soap and water for 20 seconds, to dry hands with a paper towel, and to use the paper towel to turn off the faucet. If soap and water are not available and hands are not visibly dirty, an alcohol-based hand sanitizer containing at least 60% alcohol can be used. And it's also very important to include hand washing time in student schedules whenever you can. And of course, to reinforce respiratory etiquette with students and staff as well. So we do have another poll question here. So if you can please let us know if wearing a well-fitting mask consistently and correctly reduces the risk of spreading COVID-19. Please let us know true or false. Okay, looks like almost everyone said true. So the correct answer is true. A well-fitted mask can protect you against several respiratory diseases. New Jersey Department of Health recommends that schools and childcare settings increase education on respiratory etiquette. Staff and children, as developmentally appropriate, should all be taught and asked to follow these steps to prevent the transmission of respiratory infections. To cover coughs and sneezes with a tissue or your sleeve instead of your hands, to avoid touching your eyes, nose, and mouth with unwashed hands, to wash your hands frequently, especially after coughing and sneezing, and to stay home if you're sick, especially with a fever. Additional preventative measures include to encourage routine surface cleaning and disinfecting through educating your staff and having a cleaning policy in your facility. Routinely clean and disinfect surfaces and objects that are touched often, such as desks, countertops, doorknobs, computer keyboards, hands-on learning items, faucet handles, phones, hall passes, cribs, water fountains, diaper changing areas. So tons of things to routinely clean and disinfect. And it's just very important to make sure you do have great cleaning and disinfecting schedules in your childcares and schools. So on the screen right now, you can see some recommended cleaning, sanitizing, and disinfecting protocols from New Jersey Department of Health's Environmental and Occupational Health Program. So remember, cleaning with soap and water is not always enough. It is important for childcares and schools to know when to clean, when to sanitize, and when to disinfect. So this chart is a good resource, and it shows which areas or objects require which method. Cleaning does occur with the use of soap, water, and friction to remove all visible dirt. Sanitizing, however, can reduce the amount of invisible germs on inanimate surfaces and is appropriate for items such as tables, high chairs, toys, and pacifiers. Sanitizing products are less harsh than disinfectants. Disinfecting destroys or inactivates almost all bacteria and viruses on inanimate surfaces, and may be appropriate for items such as changing tables, doors and cabinet handles, toilets, and other bathroom surfaces. But before sanitizing or disinfecting, it is recommended to first clean the objects or surface. Cleaning with soap, water, and friction does expose those germs, and it helps the object or surface to be properly sanitized or disinfected. So the link at the top of this slide does take you to this chart, and it has information in it to help you with choosing products for cleaning, sanitizing, and disinfecting as well. So products that are approved for sanitizing and disinfecting should have indication that they are approved by the EPA or Environmental Protection Agency somewhere on that label. Whenever you buy a new product, make sure to read the contact time that's on the back of the product as well. So contact time is how long the product has to actually stay on the surface to kill the germs. For example, if you have a product that says it has a contact time of 10 minutes, but you are hoping for a product that can be used very quickly, you might need to keep searching for a different product that has a shorter contact time. Also, I do know a lot of childcares and schools use disinfecting wipes. So just keep in mind that it's the liquid in those wipes that are killing the germ. So if the wipes are dried out, then it's not going to be appropriately disinfecting. So whenever they dry out, just make sure to get a new one. Of course, it's also very important to always read the directions for use on the back of the products as well, and to make sure you're safely using the products. And of course, remember to match your disinfecting activities to the types of germs that you want to remove or kill. So CDC and EPA have more specific information on cleaning and disinfecting against particular viruses. So if you would like more information on what disinfecting products are effective against a specific virus, we do encourage you to visit the websites that we've hyperlinked to these slides. Of course, if you are experiencing an outbreak or a suspected outbreak, your local health department can guide you through what disinfecting products would be recommended. So that was a lot about cleaning and disinfecting. It's also important, of course, to make sure you have an adequate supply of tissues, soap, paper towels, and alcohol-based hand rubs and disposable wipes. And schools and childcare should make sure individuals are adhering to exclusion recommendations from public health. And you can find exclusion timeframes on New Jersey Department of Health's exclusion list, which is hyperlinked to this slide. We have discussed this together in some previous webinars. It is very important to encourage students and staff to stay home when sick. Additionally, I also wanted to provide some tips from CDC about how to help individuals adhere to exclusion recommendations from public health. So according to CDC, educational settings can consider revising policies that make it difficult for students and staff to stay at home when sick or when caring for others who are sick, implementing flexible sick leave policies for students and staff, avoiding the use of perfect attendance awards, and cross-training staff so that others can cover for coworkers who may need to go home. So time for another question. This time we didn't give you any answer choices though. So if you could please let us know in the chat, how long should a child with RSV be excluded from the child care center or school? And you can use the New Jersey Department of Health exclusion list to help you with this question. We're going to place that link in the chat for you too, and I'll just give you a couple of seconds to see what responses we get in the chat. I am seeing a lot of responses come in. Awesome. Thank you guys so much. Several of you are getting it correct. So the exclusion list does RSV exactly on it, and that's because there are a lot of respiratory viruses out there circulating. So individuals with RSV, parainfluenza, human metapneumovirus, influenza, adenovirus, or a non-COVID-19 coronavirus should all be excluded until they have been fever-free for at least 24 hours without the use of fever-reducing medicine. Also, remember earlier, we said that some individuals with respiratory viruses may never have a fever, but they may still have the illness. Well, if the individual is sick, they shouldn't return to the school or childcare center until their symptoms are improving. And I just want to pull up the exclusion list now to show you just a couple more things. So that's where we see until fever-free for 24 hours without fever-reducing medicine. I just want to show at the very bottom too, that the children should also not return until they can comfortably participate in activities as determined by the staff of the school or program. And you can find language for this at the bottom in this bolded section here. I also wanted to point out a couple more things on the exclusion list. So if we go back to the page 1, we are going to find a row here for COVID-19. So New Jersey Department of Health does follow CDC's recommendations for COVID-19 exclusion. This exclusion list links to New Jersey Department of Health COVID-19 FAQ, which we are going to talk about a little bit in a second. So we'll talk about that shortly, but individuals with COVID-19 should be excluded for 5 whole days after symptom onset or test date if they are asymptomatic. And then those individuals can return on day 6 as long as they have been fever-free for 24 hours and all other symptoms are improving. We do still recommend that they wear a mask on day 6 to 10 after their positive test date or symptom onset. So that's COVID-19. I also want to show you as well that hand, foot, and mouth disease has a row on here. It's also until fever-free for 24 hours without fever-reducing medicine, but we also have additional exclusion that says until no longer drooling steadily due to mouth sores. And then I also wanted to show that influenza does have a separate row on here, but it's the exact same as RSV. So until fever-free for 24 hours without fever-reducing medicine. And now speaking of other prevention measures, we sometimes get asked if school closure is recommended in infectious disease situations. So New Jersey Department of Health does not recommend school closures for outbreaks of infectious diseases. However, educational settings should work with local health officials to determine if and when you should dismiss students based on severity of disease in your school community. Some schools may decide to close based on local considerations, such as high student and staff absenteeism rates. If this is the case, schools should consult with public health and school district medical personnel before closing. And of course, schools should also update emergency plans so they are in place before an outbreak occurs. And then additionally, ventilation is a prevention strategy that schools can implement to protect against respiratory diseases. Opening windows, using portable air cleaners, and improving building-wide filtration are ways you can increase ventilation in your school or childcare program. CDC's Ventilation in Schools and Childcare Programs webpage has a lot of great information. So again, it is hyperlinked to this slide if you would like to learn more. And another preventative action is to minimize the transmission of respiratory viruses is to educate students, parents, and staff on what to do if someone does get sick. So the DISH team does encourage you to teach your students and staff about all of these diseases. It's important to teach them what symptoms to look for and how long they should stay at home if they do get sick. So these last slides do contain educational materials and resources that you can share with your staff, students, and parents and guardians. So let's look at them together now. So this is a respiratory etiquette poster that you can print off and hang around your buildings. Again, everything is hyperlinked to the slides. It's available in a ton of different languages. If you open up this hyperlink and you scroll to the bottom of the page, you're going to find a ton of CDC hand washing resources. They are all great, but the videos here would be really fun to share with your classrooms. If you want to inform your communities about the flu, this slide hyperlinks to a very detailed letter about influenza. It is available in both English and Spanish. And you'll also notice there's an additional link here to CDC print resources. So you can see that there's several different flyers, posters, lots of things here you may find beneficial. So I encourage you to check it out later. There's also some videos you can send to your communities to educate them about influenza. So they're on this slide for you. And then this slide has an adenovirus flyer that you can share with your communities. Preventative education is the way to go. And this is a great resource to send through an email blast. And the New Jersey Department of Health has fact sheets and frequently asked questions for adenovirus as well. So if you go to this hyperlink, you're going to go to our adenovirus page, and then you could just open up the frequently asked question document. There's lots of questions on here, things such as who gets adenoviruses. So the answer is anyone can get infected with an adenovirus at any age, but infections do happen more in children than adults. People with weakened immune systems or existing respiratory or cardiac diseases are more likely than others to get very sick from an adenovirus infection. We also have an RSV page that we encourage you to check out. If you scroll to the bottom of this page, you're going to see the RSV FAQ that you can open. Lots of frequently asked questions that could help you here. Things such as RSV can survive for many hours on hard surfaces, such as tables and crib rails. It typically lives on soft surfaces, such as tissues or hands, for shorter amounts of time. People infected with RSV are usually contagious for 3 to 8 days and may become contagious even a day or two before they start showing signs of illness. However, some infants and people with weakened immune systems can continue to spread the virus even after they stop showing symptoms, for some as long as 4 weeks. And then this hyperlink takes you to our hand, foot, and mouth disease page, which is the enterovirus that we get outbreaks of a lot. So there's a frequently asked question sheet here in English and Spanish. Questions such as, how do people get hand, foot, and mouth disease? The virus that causes hand, foot, and mouth disease can be found in the throat, nose, feces, and in the fluid of blisters of an infected person. Hand, foot, and mouth disease is spread from an infected person to others through close personal contact. It can also be spread through the air when an infected person coughs or sneezes. Contact with feces or contact with contaminated objects can also spread the virus. Generally, a person with hand, foot, and mouth disease is most contagious during the first week of illness. People can sometimes be contagious for days or weeks after symptoms go away. Some people, especially adults who get infected with the virus that causes hand, foot, and mouth disease, may not have symptoms, but they may still be contagious. This is why people should always try to wash their hands and cover their coughs and sneezes to help prevent the spread of germs. So that's just an example from our FAQ. On our page here, we also have a hand, foot, and mouth disease exposure notice that you can use. It's available in English here. If you scroll down, it is available in Spanish. So if you have a case of hand, foot, and mouth disease in your childcare or school, you could send this letter out to those who may have been potentially exposed. And then this is a CDC flyer about coronaviruses. This is about the common human coronaviruses, so not COVID-19. So this may be helpful to share with those who may get diagnosed with these illnesses. And then recently, on August 31st, there was a new COVID-19 FAQ released. So I do encourage each of you to download this document. We are putting a link to it in the chat right now. This document did replace the previous New Jersey Department of Health COVID-19 guidance for schools and childcares. And so detailed information about recommendations for schools and childcares for COVID-19 can be found on CDC's operational guidance for K-12 schools and early care programs webpage. That page is hyperlinked on the first page of that FAQ document. And then the rest of this guidance document is really just frequently asked questions that we received from you in the last school year. So I just want to go over a few right now. So let's look at the bottom of page 4 together first. So the question here says, are students and staff with COVID-19 symptoms required to have a negative COVID-19 test or an alternative diagnosis before returning to school? So we have received other variations of this question as well, such as what if a parent says that the child has a cold, but they haven't been tested? So the answer to this question is New Jersey Department of Health recommends COVID-19 testing for anyone with symptoms of COVID-19. Schools may elect to have a policy that no longer requires a negative test or an alternative diagnosis for individuals with COVID-19 symptoms. However, schools should always follow exclusion recommendations for symptomatic individuals from the exclusion list. Remember, that's the document we went over together a second ago. And if your school does elect to have a policy that does not require an alternative diagnosis or a negative test for individuals with COVID-19 symptoms, then please keep in mind that there may be situations in which public health would recommend negative testing prior to returning to school, such as in situations where symptomatic individuals have a known COVID-19 exposure, or if there's an outbreak situation. Schools and childcare should always consult with your local health department for guidance about this. And I also want to point to another FAQ at the bottom that says what is considered an outbreak of COVID-19. So an outbreak of COVID-19 in school and childcare settings is defined as 5 or more individuals among students or staff with illness onsets within a 7-day period who are epidemiologically linked, do not share a household, and were not identified as close contacts of each other in another setting. So this definition is referenced in CDC's operational guidance for K-12 schools and early care and education programs. You may remember that this definition was previously 3 or more individuals. So we do have some more questions about COVID-19 we received through pre-submitted questions. We're going to go through those in a little bit, but there's just a couple more resources I want to show you right now. So one is CDC's COVID-19 print resources page. So this is another place you may want to check out with additional flyers and resources that may be beneficial to you. And then also New Jersey Department of Health has a COVID-19 page for the general public that has several flyers educational settings can use to send to families to educate them on things like isolation guidelines. And lastly, CDC does have home pages for each of these viruses. So you can find more information about each of these by going to the links that's on this last slide. So I encourage you to take a look later if you're interested in learning more. This is our references for today. And I want to thank you so much for joining us. This is a QR code that will take you to our Dish Team webpage. We do hope to see you again at our future trainings. We have several pre-submitted questions that we have from when you registered to attend today. So Stacy and I are going to try to go through some of those now. If you have additional questions after today, then please put them in the Q&A box. We will try our best to email out responses in the next few days to those we do not get to. So I'm going to ask Stacy, do we have any pre-submitted questions that we should answer right now?
We do. First one is appropriate for right now that it is fall, and it's how long does the flu season last?
Okay, so I actually want to show you where I'm getting the information that I'm going to tell you. So this is from CDC's flu season page. And so we do know that flu can be detected year-round in the United States. And it typically does begin to circulate in the fall and the winter. Usually that increase begins in October. Most of the time, the activity peaks between December and February, although significant activity can last as late as May. And I also want to show you as well that this is the New Jersey Department of Health Influenza and Respiratory Illness Surveillance Reports, where you may want to go for more information. So we're putting these things in the chat for you, and they're also in the slide set if you want to learn more.
Okay, thank you. The next question was just asking you to speak a little bit more about RSV.
So we have several resources for RSV that's in the slide deck. So we encourage